Health officials in 5 states across the United States are now keeping a very close eye on passengers who have now returned from that cruise that turned deadly from the Hantavirus. The outbreak of that rare virus has killed 3 passengers aboard that ship. It is not all that rare around the world, but it is in the United States. Several others are reportedly sick from that cruise. Now the ship is headed for the Canary Islands. And for a full evacuation, potentially in Spain, is what we're being told. Greg Palcott has more. But before we come to you, Greg, I just want to say Dr. Marc Siegel is here. He's on with the WHO right now and authorities in Netherlands and what they're telling us. So while you are reporting, we're going to scoop this up. Take it away.
Roger that, Harris. Yeah, it is a multi-pronged global operation dealing with this latest health concern. The Dutch cruise ship tainted by that Hantavirus with some 150 passengers and crew on board is nearing the end of its weeks-long voyage and maybe the most critical stage. On Sunday, it will be dropping anchor off Tenerife in the Spanish Canary Islands, where passengers from a few dozen countries, including 17 from the States, will be transferred on land to airplanes very carefully to bring them home. U.S. among the other countries providing its own aircraft. 3 people have died. Several have fallen ill on board the ship, confirmed or suspected Hantavirus cases, at least one new one. What's made things more complicated is those few dozen people, including at least 6 Americans, who had gotten off the ship before the Hantavirus had been suspected, and they've had to be tracked down and traced down. The latest theory is that a person was exposed to rodent droppings before getting on the ship. That's how you catch it. This particular strain of Hantavirus can also be spread by very close contact between people. There is no cure, symptoms or fever, respiratory distress, sometimes death, but again, that's worst case. Since officials have nailed down the disease, they've kept the passengers on board pretty much in isolation. Once they arrive at their destination, they'll be asked to quarantine for several weeks. There's as much as an 8-week incubation period. But right now, no one on board the ship is indicating any symptoms, and officials are downplaying the risk. Take a listen.
The risk remains absolutely low. This is not a new COVID.
The CDC has classified this outbreak as level 3 emergency response. That is the lowest level of emergency activation. Let's keep it that way. Back to you.
Amen to that. Greg Palcott, great reporting as always. Thank you. Dr. Marc Siegel, Fox News senior medical analyst, NYU Langone professor of medicine and author of the brand new best-selling The Miracles Among Us. It sounds like this has some daylight with it, though. So I know you've been on the phone with the WHO, and via the Netherlands authorities, we have found out that the flight attendant who was exposed to one of the people who've died, who was on the ship, that person now has tested negative. Now, what we knew just a few hours ago is that that person had mild symptoms. What's the latest?
So that she is testing negative, that's what the WHO is reporting. The WHO, and by them I mean Maria von Kerkhoff, who's the head of pandemic and epidemic preparedness for the WHO. She's one of the top infectious disease experts in the world. She's saying, to update some of what Greg's saying, is that the Andes strain, which this is a 1 to 6 week intubation period, not 8 weeks for this strain.
Good news.
Good news. Also, they're standing behind the story that the woman got it on April 1st when she was bird watching from a rodent, and then bring it onto the boat, and all 8 passengers are human-to-human contact. But again, it's very rare. Studies have shown 1% risk of human-to-human contact causing a Hantavirus spread. So I said to the WHO, what are the chances that this thing mutated? They said early studies of this virus are showing no change. They got to do a full genetic analysis, but it looks like the same virus.
All right, let's break that down. So a 1% chance normally. This is way above 1% if it's going person to person after one woman got it from a rat.
Agreed.
So, but what you're saying is it probably begins to slow down or stops there because it's not mutating to become something that's more airborne.
Well, if that's A. B, a cruise ship is not you and me. It's very confined quarters. It's easy for things to spread on a cruise ship, and it's 17% if it's sexual contact. So that explains why the couple gets it. So in other words...
Okay. Yeah, those who's perished. Look, off the coast of West Africa, the Spanish Canary Islands, I had asked the question, do they have what they need in the islands? Does Europe, does Spain, who helps to get the materials there? Because what you told me off camera was when those people pull in with that ship, If they're going to take them off that ship, they have to be quarantined.
And they're going to be looked at, examined, and a history taken before they take them off the ship. WHO has sent 2,500 test kits around, and the European CDC, the equivalent of our CDC, is right there on the Canary Islands to figure out whether there's symptoms, whether there's risk, what the exposure is, and then they will continue to quarantine them for at least that 6-week period.
You were relieved when you first heard that that flight attendant didn't get it from close quarters. By the way, the patient that she was close to, that flight attendant and potentially the whole flight staff, was taken off the flight eventually. So the passengers didn't get that long term because she was so sick she couldn't fly.
And that's also, by the way, a great precaution. And the viewers need to know, Harris and I talk about this off camera all the time. She's incredibly tuned in and brilliant on the second. When you hear that everybody's reacting or overreacting or being careful, that's what we need to be.
Right, right. And we've learned some lessons. But this is not COVID.
This is not COVID. This is very, very, very difficult to spread human to human. You said very few cases in the Americas. We're talking about 150 or so cases in all of North and South America per year of Hantavirus, and much less of that of the Andes strain. The Andes strain is one we're keeping a careful eye on. One final point, U.S. Army Infectious Disease Research, and you're, as you know, a big Army advocate, they are making an antibody to this.
So they're
making an antibody, so we're going to be able to use that soon.
I'll bring you back. I'm feeling optimistic now and praying for those people as they're monitored.
Same.
Dr. Siegel,
Good to
thank
see
you.
you.
Outnumbered next. Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.